Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Monday, June 15th, and this is my daily briefing. Today we are going to discuss current local and state case counts, as well as revisit some key components of the COVID-19 testing processes that we use at our Missoula County Fairgrounds testing site. Before I get started, I'd just like to send out a big shout out to Ken Parks to say thank you for standing in for me last week while I was out for my vacation week. So thanks, Ken. So now on to the data. This morning, Missoula County reported another positive COVID-19 case. This is an active case that remains under investigation. Preliminary investigation is indicating that this case was travel related. The case and their known contacts are in quarantine and isolation and will continue to be monitored and supported by medical staff as needed. That means that to date, we've had 42 cumulative positive cases in Missoula County. 40 of those were identified by testing and 2 were epi-linked. We've had 40 recoveries and 1 death, and we have 1 active case. The state of Montana is reporting a total of 609 cases, including 8 new cases confirmed this morning. New cases are being reported today in Custer, Bighorn, Cascade, Flathead, Ravalli, and Stillwater counties. The state DPHHS is reporting 80 active cases across Montana, and we also learned of another COVID-related death this past weekend, making that 19 deaths statewide. We stand with the governor in extending our support to the family, friends, and community that has been affected by this loss. This is a reminder that we need to continue being diligent and continue practicing safe behaviors like wearing that cloth face covering and keeping at least 6 feet between you and others when you're in larger social settings. Last week, Ken talked you through what COVID-19 testing looks like at the county fairgrounds. He shared this information to remind folks that our testing processes and our eye towards safety, which are particularly important to review ahead of sharing and implementing our countywide Sentinel testing plan at the end of this week. Recall that Sentinel testing is the strategic and prioritized testing of asymptomatic people working in high-risk environments. This means that we will be screening and testing more people in the coming weeks and months. If someone meets the county testing criteria, they're provided with an appointment and explicit instructions about what to expect next, including arriving at the appointment, learning about the coronavirus from medical staff, self-swabbing for COVID-19 under the direction and observation of nursing staff, and also receiving results with follow-up instructions from a public health nurse. So now let's talk about that self-swabbing. I totally get it that the idea of self-swabbing can be a little off-putting. That being said, there are a few things to consider about our practices, which were developed with the intention of ensuring the highest level of safety with the lowest amount of risk to the public and also to our health department personnel. We know that accurate test results are really important for our community and for individual patients. Accurate tests help inform the overall understanding of COVID-19's presence across the county, as well as to develop appropriate individual care plans as needed for individual patients if and when they test positive for COVID-19. We've been using and will continue using the CDC and FDA testing guidelines and procedures. We evaluated a variety of types of tests for things like cost, ease of use, and accuracy. We selected the mid-turbinate swab, which is as sensitive as the standard nasopharyngeal swab that's available at other testing sites. The mid-turbinate swab is shorter than the nasopharyngeal swab, and it's not inserted as far into the nasal cavity. This means that accurate testing can actually be conducted effectively by an individual with a nurse guidance and observation. Just like we're asking patients to remain in their cars and that they wear a mask while they're at the testing site for the safety of everyone involved, we also ask that patients self-swab if they feel comfortable doing so. When a patient drives up to the testing station at our testing site, a nurse in full PPE or personal protective equipment, which includes a gown, 2 sets of gloves, and an N95 respirator with a surgical mask and a face shield, will welcome the patient and talk to them about COVID-19 testing. The nurse provides self-swab instructions as well as demonstration to the best of their abilities without actually self-swabbing to the patient. If the patient confirms that they're amenable and capable of performing the self-swab, then they will then conduct the test themselves while the nurse observes. So now, why do we use the self-swab? It's all about safety. Having a patient self-swab improves the safety for all by reducing the risk for all. This means that patients and nurses have minimal direct contact, and that the contact that they do have is protected by gloves, gowns, masks, and face shield. Of course, if someone cannot self-swab for any reason, let's say they have limited mobility or they are of a young age, then that nurse will perform the procedure for them. The idea is to reduce risk, but also to capture an accurate specimen so that we know what's going on with COVID in our community, and for that, and specifically for that patient. Please note that the test is considered valid if a nurse or medical professional conducts it, or if a nurse or medical professional both guides the patient about the testing procedures as well as observes the testing procedure to ensure that the patient safely collects the specimen. I'll be sharing more information about safety and testing this week, so please continue practicing those safe behaviors that are probably second nature by now. Keep wearing that cloth face covering, keep space between you and others, keep your social circles small, clean and sanitize often, and that's it for my daily briefing. So thank you to everybody out there for doing your part to keep our COVID numbers low in our community and in our county. So as always, you can subscribe to me on YouTube. It's under my name, Cindy Farr, CindyFarr. And you can just click that little notification bell so that you get notified when new videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department Facebook page. You can check out our website at missoula.co/cvirus, and there's lots of great information there. You can also call 258-INFO or 258-4636 if you're having even the most minimal of symptoms, to get that test scheduled for you, or if you just have other general questions about COVID-19. So until tomorrow, everybody stay healthy.